In tonight's Medical Watch, it's been a perfect winter for skiers. But along with the mountains of snow comes an increase in knee injuries, especially among women.
I think that with the ACL making headlines with some of the more famous athletes, the Lindsey Vonns, the Adrian Petersons, the Derek Roses, that it gets a lot of attention.
And then there are the rest of us.
In years past, we've seen a dramatic increase in the number of ACL injuries because people are more active. In the center of the knee, the ACL.
The ACL, or Anterior Cruciate Ligament, stretches across the knee at an angle and controls the degree of rotation in the joint.
It's one of the four major ligaments, which are sort of like strong ropes, which tether the two bones together, the femur and the tibia. It's subjected to tremendous stresses.
And when it's stretched too far, it tears. Repairing the torn ligament requires surgery.
The ACL does not have a sort of an intrinsic ability to heal itself.
The rush you get just flying down the hill, learning new skills, learning how to make the turns, and just how beautiful winter actually can be.
Robin Tillman first hit the slopes more than 20 years ago. So on a trip to Colorado last winter, the experienced skier tested her skills on an intermediate run.
My ski caught an edge, I fell, the ski twisted, and it didn't pop off, and I just felt the severe pain in my knee.
This is an MRI image of Robin's knee. This ligament has torn from the femur and is sort of lying in a flattened position. Good. Can I just see you take a few steps across the room?
She returned to Chicago and called orthopedic surgeon Brian Forsythe.
Said, yeah, come in. You're actually the 6th ACL we've had called from Colorado this week. So I guess it's fairly common.
Skiing in particular is one of those sort of high demand activities where there's tremendous stresses placed across the knee joint.
Women in particular are at greater risk. The reason? Body mechanics.
Women have an alignment with a wider pelvis and a more narrow femoral notch, which sort of predisposes them biomechanically to injury. They tend to jump and land a little bit differently than the men do, with their knees in a more straightened position, which in and of itself is a risk factor for an ACL injury.
Robin underwent reconstructive surgery in April 2013 and completed 6 months of rehab. By January of this year, she was ready to ski again.
Some of my friends were like, you're going to ski again after you tore your ACL? Why do you want to do that? It's like, that's why I had the surgery, so that I could get back to doing things that I love.
My advice is to condition. There are plyometric exercises that you can do to do jump training and to work on biomechanics, which can then lessen your susceptibility to an injury. The hard part is keeping up with it and doing it on a consistent basis.
ACL injuries are on the rise in children as well. One survey found a 400% increase during the past decade. But for all age groups, Dr. Forsythe says strength training is the best way to help prevent tears.